Live.
Hi everyone. In today's debate, we will be discussing the topic of gift giving within applied behavioral analysis. Before we begin, I'll start off by introducing the group that includes myself, Jasmine. Simon will be the illustrator and fielder. Drew Humphrey will discuss the argument of why gift giving is not acceptable, while Katie Tompkins will discuss why gift giving should be acceptable. Last but not least, our summarizer for today is Giselle Valencia. However, due to video restrictions in Dubai, we will be playing pre-recorded videos through YouTube during her part of the debate. We have decided to present gift-giving in a formal debate where we will first share the counter-argument that does not support gift-giving, and behavior analysts should follow ethical guidelines. And then we will discuss the point argument that gift-giving should be okay and should not follow ethical guidelines. To begin with, gift-giving is a form of verbal and nonverbal communication with or without tangible items from one person to another. It's a universal language where giving something is done as a good gesture to say thank you or symbolizes appreciation. Someone's birthday, graduation, the holidays, or just to say a thank you. Giving usually occurs within these situations. In the fields of ABA, it is considered inappropriate for therapists to accept any gift to ensure that they all follow ethical guidelines. Ethical Compliance Code 1.06A through C states that behavior analysts should avoid multiple relationships due to harmful effects that might occur and should seek to resolve the issue. It is a behavior analyst's duty to recognize these situations and make sure to inform clients and therapists about these boundaries. Therefore, 1.06D states that behavior analysts should not accept any gifts from a client or give gifts to their clients. Gift giving can cause a dual relationship even if it's not intentional and should only pertain to conducting evidence-based treatments to clients. In our book, Ethics for Behavior Analysts by Bailey and Birch, they explain how gift giving can begin a slippery slope towards a dual relationship. For example, a mom giving a gift to therapists now might consider asking for something in return in the future. Something in return may include being flexible with billing, being asked to stay longer for a session, or being asked to babysit. Some examples of gift giving include therapists receiving small birthday cards, being offered food, receiving gift cards, and even being given water or baked good by clients or their parents. Gift giving also includes therapists giving clients gifts that include a new Lego set, bubbles, Play-Doh, etc. Whether you're being given a large gift worth up to $50 or even small gift less than $10, the main purpose of the Ethical Code 1.06D is to prevent therapists having a dual relationship with their clients and their families. When therapists are given a gift worth more than $10, they are faced with an uncomfortable situation of needing to deny the gift. And I know there are many of us that can relate where we have been in the homes of clients and have been offered to stay for dinner by parents, or during the holidays where it's the season of giving, that we have been in situations to deny items from clients. While accepting or giving gifts is a way to express gratitude and appreciation for the types of services we provide for clients and promotes a good standing relationship, behavior analysts should understand that gift giving can create a multiple relationship and should avoid receiving or giving gifts towards clients and their families. We will now begin with Janelle, who will discuss the counter-argument of why gift giving should not be considered and why we should follow the ethical guidelines of 06.
Okay, so to start, as stated by Oots, Poles, Tompkins, and Willems in Opening the Gift, Social Inclusion, Professional Codes, and Gift Giving in Long-Term Mental Health Care, gifts can be broken down into different types, including a symptom gift, a compensation gift, a courtesy gift, and a personal gift. A symptom gift is given based on the beliefs of the giver, such as feeling insecure and wanting more people to like them, and therefore the underlying reason behind giving the gift should be analyzed. A compensation gift is given due to its monetary value to render for services provided. This can cause an expectation of reciprocation due to the professional being seen as in debt to the giver. This could cloud professional judgment and creates the risk of giving preferential treatment to the gift giver. A courtesy gift is intended as a thank you to the professional because they do so much for them. As professionals, we're trained to do so much for our clients. We are already getting paid to do this, and accepting a gift as a thank you is almost like being double paid for our job. Finally, a personal gift is when the gift is chosen because it relates personally to the professional or it is uniquely appropriate to the professional. Accepting gifts in any of these categories can cause an over-personal relationship with the gift giver or client, and thus a multiple relationship.
I'm going to show you a little visual about the gifts that were just described by Janelle. Okay, so the first type she described was a symptom gift. And an example would be an apology or a simple bid for attention, but a lot of the time it's not as straightforward. So professionals should always remain cautious and adhere to the ethical code. A compensation gift. This gift says, here's some extra for your services. This can leave the professional feeling indebted and also creating a multiple relationship. This would be an example of a courtesy gift. It's a physical representation of saying thanks. Regardless of how small and simple it may seem, this and any kind of gift could cause a misunderstanding regarding professional relationships. As behavior analysts, it's our duty to serve the client and in the most meaningful, unbiased, and respectful way possible. Being it is required, tokens of thanks are unnecessary. You're just doing your job. And then the last thing I'm going to talk about is a personal gift. Therapists, especially ABA therapists, spend a lot of time around clients and their support team, parents, siblings, guardians, etc. Eventually, they're going to find out something about you besides being solely a professional. For example, they might find out you like bacon and exercise often, hence giving you the only BS I need in my life is bacon and squats shirt. Even if you do, in fact, love bacon and squats, it is important to acknowledge that this is a personal gift, and accepting would be breaking the professional code of conduct.
So due to these different types of gift giving, the giver and receiver may have different views of the relationship, which could cause ambiguity in the professional relationship. Relating to Ethical Code 1.06, multiple relationships and conflict of interest, accepting gifts could constitute a conflict of interest, possibly in the form of preferential treatment to the clients who give gifts. Furthermore, Ethical Code 1.05, professional and scientific relationships, states that behavior analysts provide services in a defined, scientific, or professional relationship role. Having an overly personal relationship doesn't fall in a professional relationship role. Next, according to Katz, Kaplan, and Mers, in All Gifts Large and Small, toward an understanding of the ethics of pharmaceutical industry gift giving. As humans, we have a tendency to engage in networks of obligation. In other words, when a gift is given, oftentimes the recipient has a sense of indebtedness, and thus can lead to reciprocation, which is strictly advised against in the Ethical Code 1.06, multiple relationships and conflicts of interest.
I'm going to show you another slide regarding the cycle of gift giving. Once I get it up. Okay, this is the continuous cycle of gift giving. It's a simple illustration of the cycle of gift giving. And once the process starts, it's hard to break. And as Janelle said, it can cause ambiguity in a therapeutic relationship. Gift giving can turn into an obligation, whether it's conscious or not. Therefore, the cycle of giving and receiving and giving a return is started. It may seem innocent, but as stated in the code, it creates multiple relationships. Ethics for Behavior Analysts by John Bailey and Mary Birch makes relevant points regarding this cycle. Behavior analysts have received from their clients anything from team logo baseball caps, sports event tickets, books, DVDs, expensive wine, baby gifts, new CDs, and even loaded gift cards. Exchanging gifts creates a dual role relationship. The client and the behavior analyst now are friends, and the BCBA is expected to return the favor at the right time. Ethics for Behavior Analysts also mentions possibly having the parents or the guardian party sign a declaration of professional practice in which the expectations are described before the service begins. It is a good way to lay the groundwork for ethical service provision, and the feeling and obligation to reciprocate happens with any size gift, either large or small, according to Katz, Kaplan, and Mers. This also states that accepting gifts can influence clinical judgment. In other words, accepting gifts can cause an ambiguity in a relationship and blur the lines of a professional relationship, which goes against Ethical Code 1.05, professional and scientific relationships.
So finally, according to Sean A. Spence in Patients Bearing Gifts, Are There Strings Attached? There are meanings behind giving gifts. For example, when a gift is given from a client, that shows the client was thinking about their clinician or their professional outside of just the services time. This shows the professional persists in the client's mind, and thus relating to Ethical Code 1.06 can cause a multiple relationship, and relating to Code 1.05, it is not a professional or scientific relationship. Historically, gifts are seen as a fee for services rendered, or something given with a corrupting intention by the gift giver. As stated earlier, we are already getting paid to do our job by our employers, and accepting a gift as a fee for services rendered is almost like being double paid for our job. Furthermore, if gifts are accepted, it may foster favorite clients. It is important to maintain justice and equity for all clients, regardless of whether or not they can afford a gift. If a favorite client arises, or in other words, a multiple relationship, which relates to Ethical Codes 1.05 and 1.06, the professional can no longer remain impartial towards providing services, and thus critical judgment of the client may no longer be possible. Ethical Code 2.09, Treatment and Intervention Efficacy, relates to critical judgment not being possible. We have an obligation to provide the most effective treatments and interventions possible, and without critical judgment, those treatments or interventions may not even be considered. Spence states that gifts from patients should never be accepted because they may conceal unconscious motives, in which case the underlying motives for the giving of the gift should be looked at. All of these articles have some limitations as well as some criticisms to take into consideration. All of these studies take place in other professions outside of behavior analysts, such as pharmacology and in the medical field. However, they can all be related directly back to behavior analysis. We, as behavior analysts, provide services to clients just like the other professions do. Furthermore, these articles are not empirical studies about gift giving, which could also serve as a limitation.
So, in ABA, practitioners tend to do much of their work in clients' homes and with their families. Do you think that denying a small token of thanks could have a negative effect on the therapy provided?
I don't think so. If you're upfront with the client and their family and have open communication about why you can't accept the gifts, I think negative effects can be avoided.
The article you mentioned by Oots, Poles, Tompkins, and Willems classifies gifts into different categories and levels. Going beyond the types of gifts they explained, do you think that a system for classifying gifts could be beneficial in the field of ABA?
I think classifying gifts by types could be beneficial, and it could help with identifying further what the client may need. The reason behind the gift giving needs to be looked at and then dealt with.
So if an ABA therapist were to be offered a bottle of water or a snack during session, would that be considered a gift? And if not, where would the distinction be?
Yes, I think this would be considered a gift because it's something that the client or the family would be giving to the therapist.
So what are some aversive consequences that can occur if you were to accept that gift?
If a small gift is accepted and down the line the client or family is unhappy with the services that are being provided, the client or the family would then be able to hold that gift over your head and could also expect some sort of retribution.
Okay. So what are some preventative strategies that you can use to help clients, including parents or others, not offer to provide you as a behavior analyst a gift?
Before services begin or at the beginning of services, you could explain to the client and their families why gift giving is not accepted in behavior analysis and what the ethical code says in layman's terms so they can fully understand it. It's important to be clear and upfront and to have open communication about this topic.
Gift giving is an ancient and universal way to express gratitude and appreciation. However, therapists have been reluctant in accepting gifts due to the potentially harmful effects of multiple relationships, boundary violation, or exploitation of clients. The cons of gift giving. Professional and Ethical Compliance Code 1.06a states that due to the potentially harmful effects of multiple relationships, behavior analysts avoid multiple relationships. Code 1.06b, behavior analysts must always be sensitive to the potentially harmful effects of multiple relationships. Code 1.06c states that behavior analysts recognize and inform clients and supervises about the potential harmful effects of multiple relationships. Code 1.06D, behavior analysts do not accept any gifts from or give any gifts from to clients because this constitutes a multiple relationship. If behavior analysts find that due to unforeseen factors, a multiple relationship has arisen, they seek to resolve it. Accepting gifts can influence or manipulate therapeutic relationships. While accepting gifts from clients can promote self-expression, it can reinforce the belief that gift giving is a way of forming a more personal relationship. Accepting gifts may nurture favorite clients and influence therapist behavior toward these clients. Code 1.05, behavior analysts must provide services in a defined professional or scientific relationship role. With the acceptance of gifts from clients, therapists may feel obligated to reciprocate a gift by providing services to the client. Code 2.06E, behavior analysts must not share or create situations likely to result in the sharing of any identifying information, such as written, photographic, or video, about current clients and supervises within social media context. Accepting gifts from clients may form personal relationships between therapists and clients and may affect confidentiality. Gifts keep doors of communication open between both parties. With open communication, therapists and clients may discuss any personal information. Code 2.09, Treatment Intervention Efficacy. A. Clients have a right to effective treatment, and B. Behavior analysts have the responsibility to advocate for the appropriate amount of and level of service provision and oversight required to meet the defined behavior change program goals. As mentioned, accepting gifts influences therapist behavior toward clients, and therefore influences the treatment and level of services provided.
Although we have to abide by ethical guidelines and ensure that behavior analysts are not partaking in any gift giving, Section 2.0 in the Ethical Compliance Code states that behavior analysts have a responsibility to operate in the best interest of the client. This means that it is important that behavior analysts should consider their clients and their family's well-being when being offered a gift to show appreciation towards their therapist without having a multiple relationship with one another. Katie will now further discuss the pro side of gift giving, of why it should be okay to accept gifts, and why we should not consider the following ethical guideline of 1.06.
The first study that I am going to discuss is an article by Brown and Trangsrud called Factors Associated with the Acceptance and Decline of Client Gift Giving. The purpose of the research was to determine in which situations and what types of gifts therapists would accept or reject a gift. The authors asked 4 questions to 40 licensed psychologists who are currently practicing and also held a PhD. After being given scenarios, After being given the scenarios, psychologists would indicate whether or not they would accept the gifts and list their reasons for their decision. Out of the 4 scenarios, there was one gift that a majority of the psychologists stated they would accept. The gift was from a 40-year-old Native American woman given at the end of her treatment with her therapist, and the gift was considered an honor in her tribe. Some reasons psychologists believed that they would accept the gift were because they believed they would need to be sensitive to the client's culture in that situation. The client was sharing gratitude, or because the gift was inexpensive. For the other 3 scenarios, participants believed they would not accept the gifts because of their high cost, sentimental value, they felt they were being manipulated, or because it was the middle of their treatment phase. The article states that the American Psychological Association believes that psychologists may need to adjust their treatment to meet the cultural needs of their clients.
I'm going to show another slide. Pull it up really quick. Okay, so these are some reasons to accept or decline a gift. The central purpose of whether to accept or decline a gift should be to preserve the therapeutic relationship, as you see in the middle. Gifts low in monetary value, such as pens, gum, or a candy bar, may pose very little risk of professionalism being compromised. In comparison, if a gift is worth a lot of money, it would be reasonable to decline it. If it's the last time a client will be seeing the therapist, it could be reasonable to accept a small token of thanks. And also, cultural sensitivity also comes into play when accepting or declining gifts. Often, clients are already socially isolated, so it may not be beneficial to decline a gift if it would be alienating, especially if it was something like a drawing or a thank you card.
According to the Behavior Analyst Certification Board Ethics Code 1.05e, Professional and Scientific Relationships, behavior analysts will work to avoid behavior that could be considered demeaning to a person's culture. The authors conclude that there are several factors that go into accepting a gift, such as cultural sensitivity, fear of alienating the client, denying a gift because of its monetary value, or perceived harm to the therapist-client relationship. However, it is important to make a decision that is both ethical and in the best interest of the client. The participants believe they were able to make that decision without needing to ask the client, simply based on the gift and the conditions under which it was given. Hahn suggests in his article, Gifts in Psychotherapy, an Intersubjective Approach to Patient Gifts, that both the therapist and the client or patient need to be a part of the therapeutic process. This means that denying a gift from a patient could potentially damage the relationship and leave the client to feeling rejected. The author suggests an intersubjective approach to accepting gifts, and that gift giving can lead to increased opportunities for improving the therapeutic relationship. The intersubjective approach also recommends seeking to understand the purpose or intentions behind the gift. That includes asking the client or patient about the gift and figuring out where the idea came from. The author goes on to describe case scenarios and how therapy can be facilitated after a practitioner accepts a gift. Hahn also presents scenarios where a therapeutic relationship was harmed because of the rejection of a gift or simply because the therapist considered whether or not to accept a gift. The article states that it would not be fair to expect the client to never wish to make that connection, and forcing a therapist to deny that attempt could hurt the client. Doing so would go against the core ethical principle of treating people with care and compassion and the BACB Ethics Code 2.0, Behavior Analyst Responsibility to Clients, which states that it is the duty of behavior analysts to do what's best for their clients. A therapist may not be acting ethically if they are engaging in a behavior that could be harmful to their client. In the article, The Price of a Gift, an Approach to Receiving Gifts from Patients in Psychiatric Practice by Brendel, Chu, Radin, Leeper, Pope, Sampson, and Bodkin, offers somewhat of a solution by presenting a case study with a list of questions therapists can ask themselves before accepting or declining a gift, and follows up with case scenarios that represent typical gift-giving situations that therapists face. The authors conclude that these decisions need to be made on a case-by-case basis, and that there is no one-size-fits-all. VACB Ethics Code 2.09a, Treatment/Intervention Efficacy, tells us that we need to have individualized treatment for our clients and patients, and gift giving could be addressed the same way. Additionally, this could also go against Code 4.07, Environmental Conditions that interfere with implementation, by creating an environment that could inhibit a client's treatment if a client has their feelings hurt due to a declined gift.
I want to elaborate on the article that Katie was just talking about. Let me get to it again. Okay. So in the article written by Brendel, Chu, Radin, Leeper, Pope, Sampson, and Bodkin that Katie just talked to, there are 6 questions that are posed to ask when accepting a gift. And when it comes down to it, the client's well-being and success should be on the forefront of all practitioners' minds, and every question should be scrutinized. If necessary, it may be beneficial to speak with other professionals to determine whether or not to accept the gift, as long as doing so is not limited in your professional code of ethics. Most professionals agree that gifts of high monetary value should not be accepted, which addresses the first question. The gift may be exploitative. To reiterate the questions to be contemplated, they are, the first one would be, would accepting a gift be exploitative, meaning that it would benefit the clinician and possibly harm the patient financially, emotionally, or otherwise? The second question asks, is the gift of great monetary or sentimental value to the patient, the clinician, or others in the community? Third would be, is the gift extremely valuable or desirable to the clinician? If it is, the clinician should reflect carefully on whether his or her judgment or performance would be compromised by accepting that gift. The fourth question you're supposed to ask would be, would accepting the gift run counter to professional norms in one's practice community? Basically, is all the other professionals doing it? Number 5, would declining the gift be hurtful, traumatic, or otherwise counter-therapeutic to the patient? And number 6, is the clinician's deliberation about accepting or declining the gift guided primarily by the consideration of the patient's best interest?
Some limitations for the research include that the studies were not based off of the field of applied behavior analysis, so it is unclear how a BCBA or an RBT would respond. Since behavior analysts typically have different relationships with their clients than traditional therapists do, this approach would need to be adapted to working with clients in similar contexts. Some of the authors also do not provide suggestions for when gifts are too expensive, inappropriate, or when accepting a gift could potentially harm the patient in the long run. Some of the scenarios also did not indicate how the therapeutic relationship might unfold after accepting or declining a gift. Finally, 2 of the papers were not based off of real-life scenarios, so it may not be fully representative of what might actually happen.
So what happens if a parent gives you a small gift that you accept, but 6 months later, the parent decides they're unhappy with the services you're providing and starts to seek out retribution?
A parent retaliating months after a gift being given or accepted most likely would not be due to the gift itself, but instead related to the treatment or another factor. This means that the BCBA should seek out the true reason for their unhappiness.
So to what extent is gift giving appropriate? Where is the line between a professional relationship and a friendship when it comes to gift giving?
Gift giving would be appropriate as much as it is socially appropriate. Boundaries would need to be communicated if the gift giving becomes inappropriate, and a therapist would still need to be aware of dual relationships. Additionally, the other codes would still apply to ensure that behavior analysts are being ethical.
So do you think there is a potential for bias or favoritism, even if it is unconscious, after receiving gifts from clients?
I believe that there is always a potential for bias. However, most people in the field of applied behavior analysis are there to help their clients, and the gift should not determine the level of care a client receives.
So do you think that the BACB ethical code should be altered to allow for gifts to be given or received? And if so, what should it state instead?
The code could include some guidelines and boundaries for accepting gifts, such as a price limit or considering the conditions the gift was given under. This could also be at the discretion of the BCBA in charge of the case.
Hello everyone, my name is Giselle Valencia and I will be summarizing our debate. The argument on whether to accept or decline gifts from clients has caused ethical dilemma among therapists and other professionals. Some argue that accepting gifts is unethical and impairs therapeutic relationships, while others believe that accepting gifts from clients promotes personal growth and development in clients and enhances therapeutic alliance. The pros of gift giving. Professional and Ethical Compliance Code 4.07b states that if environmental conditions hinder implementation of behavior change program, behavior analysts seek to eliminate the environmental constraints or identify in writing the obstacles of doing so. Accepting gifts from clients help develop self-worth and self-understanding. Through gift giving, clients learn to communicate their needs and express themselves. And the refusal of these gifts by therapists could inhibit their self-expression. Offering items to another person is a way of establishing relationships. Rejection of the gifts might cause a client to feel rejected. Declining the gift may affect the client's ability to trust the therapist. Declining gifts can be offensive to clients and may cause them to feel rejected. The feeling of rejection can be detrimental to therapeutic relationship and therapeutic process. Code 1.05e, behavior analysts do not knowingly engage in behavior that is harassing or demeaning to persons with whom they interact in their work based on factors such as those persons' age, gender, race, culture, ethnicity, national origin, religion, sexual orientation, disability, language, or socioeconomic status, in accordance with law. Gift giving is an important part of some cultures, and the rejection of the gifts may mean rejection or disrespect to a client's customs. As mentioned, declining gifts can be offensive to clients and may cause them to feel rejected. The feeling of rejection can be detrimental to therapeutic relationship and therapeutic process. In conclusion, therapists and other professionals must consider the meaning or purpose of gift giving before deciding to accept or decline a gift. Failure to understand the client's subjective reasons for giving the gift is a failure to acknowledge the person's self-worth and self-understanding. The end result of accepting or declining the gift must be considered, and therapists and other professionals must be sensitive to the cultural values of the clients. Not all gifts are acceptable, but rejecting a present can result in a serious rupture in the therapeutic relationship. Behavior analysts should always refer to the code and consider the pros and cons of their action. Behavior analysts have a responsibility to operate in the best interest of the client, as stated by the Code 2.0, Behavior Analyst Responsibility to Clients.
Thank you all for watching our debate. Gift giving is an important aspect to consider in the field of ABA due to the harmful effects of creating a dual relationship with clients and their families. Although gift giving is socially acceptable and naturally occurs to show gratitude and appreciation, the Ethical Compliance Code Section 1.06d does state that we should not accept any gifts or give any gifts to clients because it constitutes a multiple relationship. Therefore, we should consider informing parents in the beginning of services of what to expect to avoid any miscommunication, and to prevent therapists from feeling uncomfortable to deny or return the gifts. Overall, behavior analysts should ensure professional and quality services and should not expect anything more than a thank you from their clients and their families that they work with. Hope you all enjoyed. Thank you.
And I'm gonna share the references with you guys.